we are going to talk all about what we consider Chiropractic 101. And what I really want to kind of log into here, or to have you focus in on, our three main points. Now, the three main points are going to be helping you understand a little bit more about when you get adjusted, what's that sound you hear? That's number 1 point. Number 2 point, what are the risks of chiropractic? Are there any? And how does that compare to other things? And third, what are the risks if you choose not to have chiropractic care? What are the risks if you choose other forms of health care or do nothing? So we're going to kind of go through those basic things. To start off with, I want to make sure that I'm always kind of bringing this home in the sense of, why are we here? Why do we do this? Why do you get on this line? Why does someone come here to be live? Well, first and foremost is because in our office, if we're trying to give you health and give you as much that you can get out of getting your body to be well, that there's only so much I can do for you. We have seen throughout the years that research shows us that passive care, meaning care that doesn't really require a lot of energy, someone does the work for you, so to speak, and adjustments like that to some degree. A massage is like that, probably like a massage gun to some degree, might be a little bit passive. But active care, or care that you're actively involved in, produces much better results in the long term. Short-term passive care may be necessary and needed. You might not be able to be active to do certain things. But the reason that we teach you is not only just so you can do active exercises or rehab, but you can actively be involved in the healing, meaning that what is it that you're doing on a regular basis that's helping your body get to a higher level of health and function. And that's what each one of these workshops is, to give you a little nugget of what could I do, what should I be doing, and what benefits should I be getting from chiropractic. Well, tonight is kind of 101, is just saying, hey, pay attention to these. Make as many as you can, because 40% of your success is going to come from what you do outside of our office and not what we do for you inside the office. So you need to actively be involved. If you're coming to these workshops, if you are asking questions, and soon we're actually going to have all these posted online a week or two late with worksheets that you can re-watch them, relearn them, you can fill them out, and we're going to start to give you perks. We're going to give you a punch card, so to speak, it's a well rewards card that if you make it a workshop live, we'll make sure we punch it next time we see you. If you do one online and you bring in the worksheet, we'll give a punch for that. These punches are going to kind of add up to little gifts and prizes, because we want to motivate you. We don't want you to pay for more of this. You pay in your care, and we give you the knowledge. We want you to have the knowledge, because we know that someone who comes to the office and learns and engages in the process is going to get better faster, you're going to stay well longer, and you'll be less dependent upon us or any other doctor. So ultimately, what we want for you is to be well. And remember, I'll share my heart's desire again, as I love to learn creative ways to help fill people up and see them succeed. So when I'm learning that, I'm trying to teach you those things. And being part of this process, you could have chosen to do a lot of things tonight, but you chose to be here. So listen with not just your head. Some of this could be heady, but listen with your heart, because ultimately motivation and change happens from the inside out. So we need to start to listen more than just our heads. We're bombarded with knowledge, and my point is not to give you too much knowledge. It's to just open your mind to some more thinking, and that's tonight's more chiropractic thinking. So let's start with point number 1, and you might see this around the office. So if you don't know, what it is that I talked about, or you forget, you'll probably see this around the office. But it's, what is that popping sound? That's what we're going to talk about. What is that sound? Do I have to pop when he adjusts me? Why do I pop? Why do some people not pop? But is that dangerous? You probably heard, hey, if you pop your knuckles, you're going to have arthritis. That's been very disproven in the research. But what they did, because there's a lot of theories of what that pop was, is it a tendon snapping? Is it a bone cracking? They did an MRI study in which they actually tractioned the joint. They kind of pulled on it until they felt that release or that pop. And what they saw on the MRI was that the joint space itself didn't change a lot, but at the very end there, it slightly changed or give more space, and when that happened, they saw air bubbles form within the joint. So the joint has fluid. Joint fluid itself has different chemicals in there, but when we put pressure or tension onto that joint, that fluid goes from a liquid inside to a gas and forms gas bubbles. Just when we pop our knuckles, it's going to be a nitrogen gas release from the joint to release pressure. Most of my patients, when we feel subluxations and restricted motion, we know know that that joint fluid's under more pressure and it's tense, it's not moving. When we quickly stretch it and change the pressure, that releases air or gas. And the research has shown this over time, that there's absolutely no evidence of people who crack their knuckles too much that have osteoarthritis in their hands more than someone who doesn't. That is a misnomer. You want to keep joints moving. And that's what chiropractic does. Remember, if your body is stiff and restricted, that lack of motion ultimately turns off little muscles along your spine. They're almost like little rotator cuff muscles, little stabilizers. And if they're turned off, this is when injuries start to build up because you're not sensing proper movement. You're not using proper mechanics. And so if those muscles aren't stabilizing you, it only takes a matter of time, that straw that breaks the camel's back, until boom, you've got a big problem. And it could lead to arthritis and other things down the road, but it starts with restriction and it starts with a turn off of little muscles. When we adjust you quickly, that quick stretch, that release, that vibration, that pop, causes the brain and nervous system to say what just happened, turns things back on so that it can understand what just happened. And that's when it turns those muscles back on that were turned off. And motion comes back. So proper motion leads to less decay and deterioration in your spine on a very simple level. But it also allows parts of your brain to communicate to other parts of your body better. So the popping sound, very safe. You may feel it, you may not. Just if someone never felt a pop in their chiropractic adjustment doesn't mean that it wasn't effective. It just means that your joint fluid didn't change pressure and that the care that we're giving you might be more gentle. It might be slower. It may be more where we're trying to let your nervous system and body calm down a little bit before it is allowed more of a force. So it takes time. That's point number one. What is that popping sound and what does the research show? Now you can read that. Let's go to the safety of chiropractic. I would say if I had to make one generalized statement, I'm just going to read right off of here, the research shows this, that chiropractic care is safe, ultimately safe, and it's effective. There may be procedures that could be very dangerous, but have some benefit, and effective, but there's risk. Chiropractic adds benefit with very little risk. And there's a lot, most studies have shown, actually all of them, that chiropractic satisfaction is very high, so much higher than any medical profession. When we go to big conferences and people who represent us sit around a table with other medical professions, they ask, how do you guys get such high ratings of satisfaction with your patients? And the person who represents us simply tells them, because we touch them and we listen. But there is something very natural about being touched and healing. But anything that has some benefit could have some risk. It's possible with anything. I mean, we are touching and moving the joints and the spine, but those risks overall are very minimal, very rare. Let's put it that way too. But virtually anything that has a benefit could have some risk, but adverse effects can happen. I would say the most common in most of the research would say some soreness that does go away after a couple weeks, and that mainly happens because your body is adapting to a change. If we reset your body into a place where it is now holding itself more to the left than it was to the right, then different muscles are working. And that's just like going to the gym and saying, I'm going to start lifting this, and I hadn't done it for months. You're going to be sore. You're going to be stiff. But when those muscles turn back on, you're going to start to be more balanced and stronger. So that's usually, come and go kind of a thing. Basically, this too, what a lot of the statistics would tell us is that the being seriously hurt from a chiropractic adjustment is extremely rare. And that if it's so rare that the statistics would say you're about 10 times more likely to be in a serious driving accident, on your way to our office or back. You're 10 times more likely to have a serious event driving than you are being at the chiropractor. So it's extremely safe. It doesn't mean that things can't happen, but majority of the time, people have an unfounded fear in getting adjusted. I don't want to make it worse. Oh, that might break my neck. If these things were happening, one thing I would tell people is this as well, is that means that my malpractice would be much higher. So if you look at statistics and numbers, the actuaries and insurance know exactly their risk. They're very bright people. And they know the amount of claims that come from chiropractic offices and how severe, and what payouts of those things are. So if I put that in relationship, they also know what your primary care doctor's risks are of prescribing medicines or, dealing with the conditions they deal with. My malpractice every year costs me about $2,000, something like that, maybe $2,500, maybe what a family might pay for driving insurance, right? A medical doctor is paying at the bare minimum probably about $60,000 a year. and they're practicing medicine, which is not hands-on. It definitely deals with chemicals usually. But you can only imagine that surgeons, OBGYNs, much, much higher. You've probably even heard of people leaving, saying, hey, the malpractice is too high, I'm not practicing anymore, I'm leaving the area. So there is definitely risks, and if we look at what people have to pay in order to be protected from those risks, that would tell you a little bit more of the story of what's happening out there too. So just remember those kinds of facts. I wanted to let the last point is this. There's a couple just small stats that I want to go through. Number one is this, is that you just kind of understand that we as Americans comprise 5% of the world's population. Somehow, I felt like going through school, I was pumped up to believe we were I don't know, we were half the world at least, weren't we? We only comprise 5% of the world's population. What percent of the world's drugs do we take in America? So we comprise 5% of the world population. It's 50%. We're about one of the few countries that allow drug commercial, lots of reasons, but just know that we consume a lot of drugs. What I would say is this, that if medications were to create health for our community and our country, we should definitely have the highest ratings in health statistics. Would that make sense? If someone were to make that assumption, saying, hey, well, medications make us healthy, so that means the more medications that their country takes, the healthier we should be. We rank 79th in healthcare outcomes. It's like one of the worst healthcare outcomes of any nation. We're 79th, we're right behind Mongolia. Okay, so then bringing this up to say, there may be risks with things that we do, or you might hear things about risks in chiropractic office or natural medicine. But if you don't choose to try to change your body, if you're having issues and you want to make a change, because ultimately not changing is going to definitely lead you down a road of more and more dysfunction. I mean, that's just true. Trying to make some change, chiropractic or not. But if you choose to have a medical approach to your care, meaning drugs or surgery or something in that realm, which is the majority of what most Americans start with, that means that you're actually putting yourself at risk. So here's our last little quiz question. Of the leading causes of death, where does our medical healthcare system rank in causing death? So, let's say there's heart disease, cancer, right? I think there's probably just accidents themselves. But our medical care causes deaths too. It just does. Like I said, anything with benefit could have some risk. Where does it rank? It's 3, the third leading cause of death. So America's pharma-run kind of medical system is the third leading cause of death. Just kind of putting it all in perspective. If we take care of ourselves and we keep ourselves at a place in which we need less medical care, we're actually reducing our risk of death to some degree. Right? Does that all make sense? So that doesn't mean that there isn't benefits at times to be at the hospital, to need emergency care. But we have taken an emergency care model or a sick care model and tried to create it to become a healthcare system. We're not deficient in Prozac. Although, we'll just say this stat, I might use this one again, so remember this, that 1 in 4 women are on antidepressants and 40% of teens have mental health diagnosis, right? So is it a deficiency of Prozac? Is it, what is it that's going on? But what I would say is this, is that if we're deficient or dysfunctional, if you're misaligned, there's no pill, potion, or lotion that's going to realign your body. If we want to teach you as best as we can with the knowledge and skills that we've been given and the experience that we're continuing to gain, is how do we help your body work from the inside out, not force it to change from the outside in. And it's going to take time to learn that. It's going to take time to relearn that. I just talked to someone on the table today, and she said, hey, have you ever heard of this form of massage? I go, oh yeah, I heard it's really good. I like it. And she's like, oh yeah, it's intensive, and I go through all this stuff. And I started to share with her a little bit more about that passive process. There's only so much a passive process can help till we actively get involved. And even if you had a perfect system in which I could take your body's alignment and I could change it, 10% or 20%, and then eventually get you to 100% of a perfect alignment and perfect movement, that would also be assuming that somehow stressors never happened in the amount of time that I was trying to align you. That this is a process that we continue to work and we continue to have to look at. We want to get you to a better place and maintain as best as we can, but no, maintaining is just as diligent of work as it is trying to fix and correct. But an ounce of prevention is worth a pound of cure. But to be done, are we ever done brushing our teeth? Are we ever done, learning or praying or, whatever that is, are we really done? To be working on our health means that we are constantly trying to assess where our stressors are coming from and how to remove some of them. Not all of them, not all at once. That's why these workshops are here to just kind of open your mind. The first Tuesday of every month hopefully just opens your mind to thinking. Not really an action that I have for you, other than make it to these workshops. That's your action call. That's your action call. Make it. Just be here. But number two is that we will then start to build up, give you a foundation of how do you eat well. How do you move well? And how do you think well? And we're going to repeat things because we'll need them. You might have heard something and then years later heard the same thing and had a whole different meaning to you in that time in your life. So today is understanding that there are risks with anything, but chiropractic has a very evident record of success. That there are risks to medicine as much as there are benefits. And that if our bodies are popping and clicking, it's not the end of the world. It's just a natural reaction of a joint releasing air. The fact that you guys are here means that there's hope. And I appreciate that because I think a society that is healthier and wiser is one that can make real change. A sick and desperate society that is uneducated has a lot less chance of making changes. And, this is what we're all about. It comes from the inside this office to outside. So thank you for being here. You guys have all a good night, and I'll see you soon. Bye-bye.